Local and live, covering Franklin and Washington counties, it's Let's Talk Tri-State with Tiny and Katie.
Let's talk Tri-State.
Welcome back to Let's Talk Tri-State, all powered by Home Right Windows and Doors in Waynesboro, the right choice winner in the 2024 Best of the Tri-State. Our next guest today, we have David Grant, who is the Chief Operating Officer, the COO of Keystone Rural Health Center. Thank you so much for spending time with us today on Let's Talk Tri-State. And to be honest with you, David, I don't know a whole lot about Keystone Rural Health Center, so I'm going to let you walk us through the mission and what is it? What do you guys do?
Great. Well, thank you, and thanks for having me this morning.
Sure.
We at Keystone really appreciate it. So I think I'll start really from the beginning. Keystone Rural Health Center, we go by Keystone Health, is a federally qualified healthcare center, or FQHC. And FQHC, they started in 1965, President Johnson with his war on poverty. And then approximately 10 years later, the Section 330 of the Public Health Service Act was enacted to help fund rural health centers across the country. Today, there are approximately 1,400 FQHCs in the country, serving over 30 million Americans.
Wow.
Yeah, they're the safety net, but also in many communities such as Chambersburg, Franklin County, they're also a provider of choice.
Okay. This might be a silly question, but is Chambersburg considered a rural area?
You know, it's interesting. It's shifted over the years. We're less rural than we used to be, depending on federal designation. But in general, there's still areas that are considered underserved, and that's where your FQHCs fit in.
Okay. And what are some of the different services that you offer?
So we have, interestingly enough, Keystone, I'll tell you a little bit about our founder. Her name is Joanne Cochran. Joanne founded Keystone in 1986 with the primary mission of taking care of the poor. She is a former Catholic nun, still very faithful, very active. She's large and in charge.
So she's been there for 38 years.
From the beginning, and we're grateful to have her there as our leader. She always brings us back to the mission, and that's to care for the poor and underserved in the community. That said, she never wanted Keystone Health to be the healthcare provider of last resort. So I always tell anyone coming to work at Keystone, you will see everybody from the homeless through the more affluent in the community, and that's the way the model was set up. So it's not just a safety net, at least in Franklin County. And what Joanne did versus growing outward and moving into bordering counties and otherwise, she increased the services within Franklin County itself. And so we're a bit unique. We're the third largest federally qualified healthcare center in Pennsylvania. Okay. We see approximately 65,000 individuals in a county of 155,000.
That is unbelievable.
So, and we do that through, and I brought my cheat sheet off to be honest, because I don't want to forget anything. We have, our services include family medicine, pediatric speech therapy, pediatric occupational therapy, pediatric audiology, and these are many times children who would have nowhere else to go for those services. We have behavioral health, which includes both psychiatry and therapies.
Is that for pediatric as well, or is that both?
That is adults as well, so both peds and adult behavioral health. Chiropractic. We run the local crisis intervention program, in part funded by the county. We have an urgent care program. We have pediatrics offices in both Chambersburg and Waynesboro. We have a pediatric clinic at Chambersburg Area Senior High School. We have a pediatric dentistry practice in Chambersburg. We have women's care, which is obstetrics and gynecology, internal medicine, which is adult medicine, so that's anyone 18 and older. Infectious disease, we're fortunate enough in this county to have the 3 board-certified infectious disease doctors, which is unheard of in a county of this size. But there's a strong partnership with infectious disease and WellSpan at the hospital as well. We have a foot and ankle practice. We have a sexually transmitted disease, family planning, and healthy women clinic. We have a dental program, and to say that is doesn't do it justice. In the next couple of years, my memory and numbers are correct, we will have close to over 60 dental operatories in Franklin County. So think of 60 dental chairs. We also have a seasonal farm worker program. So Keystone cares for seasonal farm workers throughout the state of Pennsylvania. We have 2 sites, physical brick and mortar sites where we do that, one in Gardner's, and we have one in Wyomissing. Other than that, we will do that under contract. So we have an agreement with, say, Penn State, St. Joe's, and they can care for agricultural workers there, and we pay for that through Keystone funding.
Wow. Is there any area in which you guys are looking to grow that you see a need for?
You know, at this point, we're going to grow our footprint, but not necessarily our services at this state.
Yeah, you have a pretty wide variety there.
I also didn't mention that we have a pharmacy. We have our own retail pharmacy that is open to the public, and we have a navigator program. So if you don't have insurance and you don't know where to go, you can come to Keystone and we'll help guide you. I have a personal story about that. Prior to working at Keystone, I had my niece who worked. She went to college. She got out sort of in between, trying to figure out where she was headed. She was working at a local restaurant at the time, did not have health insurance, and she was in her mid-20s. And she said, you know, Uncle Dave, what am I going to do? I don't have health insurance. And I said, you know, I heard of this place called Keystone Health. I said, I didn't know much about it at the time, but I understand if you go there, they will provide care for you on a sliding fee program, which is what we have. And so she was able to go to Keystone, see the navigators, provide her information, and get excellent care at a price she could afford based on her income at the time.
And she's not an anomaly, you know,
No.
mid-20s, early 20s, trying to figure out their career path, what you're going to do. I mean, I was there as well.
Yeah.
Now, with Keystone, is it specifically for people who do not have insurance, or is it for anybody?
Anybody.
Okay.
Yep.
And so if somebody is from a lower like socioeconomic status, or they don't have insurance and they come into Keystone and they need care.
Right.
I know you touched upon this earlier. There is some kind of way that you work financially then so that they can obtain the services needed.
Exactly.
How does that work?
So federally qualified healthcare centers are, the governing body is HRSA, Health Resources and Services Administration, so HRSA.gov. And we have to have a sliding fee program based on income. And that sliding fee program, we have to test it periodically to ensure it's not a barrier to care. So patients can come in and potentially have a nominal fee associated with a visit. So maybe you and I might have to pay $30, for example, for a primary care visit, whereas we can put somebody on a sliding fee and they can pay much less than that. So I hope that answered your question.
Yes, it does. Because I know even with insurance, if I have to go see a foot doctor or even the dentist, I mean, it can be wildly expensive with insurance.
Indeed. In fact, on our dental wait list, I think, you know, you try and keep a wait list the best that you can. We have approximately 3,000 people waiting for dental care.
In Franklin County. I think that's the part that's kind of blowing my mind is it's just in this small little county.
Right. Hence why we're building.
Yes, that's great. How many physicians and providers do you have at the moment?
So we are likely up to at least 125. And that would include doctors, therapists, nurse practitioners, physician's assistants, dental hygienists, dentists. I'm sure I've missed a couple, but yeah, we're well above 120, 125 at this point.
Are there any employment opportunities with Keystone?
We're looking for dentists.
You're looking for dentists?
Yeah. We've been grateful that we've been able to hire most recently. We were able to hire family medicine, internal medicine, so we're very excited to see those positions starting here this year. So when you hire a physician, there's generally a long lead time. Physicians typically don't move, and especially don't move to rural communities. You know, if we were in a larger city, it's more plentiful.
Yeah, there's more
no matter what.
There.
Rural medicine is difficult, although what's fascinating is generally the salaries and benefits are higher in rural communities because it's harder to recruit. So
there's more incentive.
A little more incentive to come here, but you know, amenities are always important. So we've been grateful we've been able to hire family physicians Actually, we've been able to hire dentists here recently as well. We'll be looking for dentists in 2026.
Okay.
So just to back up a moment, we have two big projects coming in the next couple of years. On July 1st of this year, we'll be opening a center at Catherine Street in Chambersburg. That center will have, the bottom floor will have a behavioral health urgent care walk-in program, as well as some scheduled visits. A medical urgent care on the first floor. Second floor will have 10 dental operatories, so a dental office with 10 chairs. The outreach program, which will be the STD Healthy Women Family Planning Program, will move there as well. It's now at 111 Chambers Hill Drive. And then the third floor is Keystone Family Medicine, but we have a partnership developed with WellSpan for family medicine residents. So we'll have a residency program in concert with WellSpan at that site as well. In 2026, we're going to be, actually very soon, hopefully, we'll be breaking ground on a center on Welty Road behind Tractor Supply. And that center will have, I hope I don't miss anything because it's hard to keep up with, the gentleman who builds our buildings, John, I don't know how he does it, John McElwee, but he has built many buildings in this community for healthcare. We're going to have internal medicine, pediatrics, foot and ankle, chiropractic, pediatric developmental center as well at that site, and likely some behavioral health. So the need is there. You know, if you in behavioral health, what's fascinating is if you have means, you can probably get an appointment with a therapist tomorrow. But if you don't, if you don't have the means to do so, it could take a year, 2 years.
It's interesting that you are touching upon the behavior therapy piece, because I wanted to as well. Coming from somebody who I had anxiety my entire life, and I go to therapy pretty regularly. For me to get in with my therapist took me over a year to find her.
Right.
And she's a good one, you know, someone who is very qualified.
Sure.
So I can imagine, I think there is such a need for mental health, behavioral health that isn't readily available to the public. And quickly, you need it quickly,
Right.
not in 6 months. You know, if you're having a nervous breakdown, 6 months isn't going to help you out.
Right.
So I wanted to ask you, you said that on July 1st of 25
Right.
in the new facility,
Correct.
you're going to have a behavioral health floor and then a medical floor. Is that something that you have separated out now and you're just moving the services over there?
We do. The piece that will happen in July, both the medical and the behavioral health urgent care programs are going to be on the same floor.
Okay.
So they're adjacent. And you know, as it goes, you know, the best laid plans. We believe we have it staffed. So theory is, let's just say you had a traumatic event in your life. You know, whether it be a divorce, a child
Death,
creating problems, death, job loss, what have you. You can walk into this center and immediately access some behavioral health resources. It won't be as full as, you know, the overnight stay type situations, but you should be able to access some resources, and we can guide you then and hopefully get you into treatment much sooner.
That's
than
wonderful.
Otherwise.
I think there's such a need for it. I'm happy to hear that. That's really great.
And the crisis teams tell me that the majority of the crisis visits we see, today our crisis is located in Chambersburg Hospital's emergency department. Adolescents.
Oh, absolutely.
Yeah, right. It's not surprising.
Absolutely. Wow, that's wonderful news. Lots of big things happening for Keystone. David, before we wrap up here, is there anything else you want to touch upon or share about Keystone before you kind of just give me where people can find you if they have questions?
You know, I think in particular, I've been with Keystone now since 2017. Healthcare is difficult, no question, no matter where you're at today. But whenever I walk around the halls of Keystone, it was true in 2017 and it's true today, you feel the mission. You know, you feel why people are there. And to me, I'm grateful to the staff and all the senior management at Keystone for that.
That's great. I mean, I think
and Joanne's vision, just to continue to care for the poor and really anybody who needs health care. Like I said, we care for everybody from the homeless to the most affluent in the community.
And I think it's good to do it with grace. And I think sometimes people forget that bedside manner or how stressful it can be to be getting medical care. So it
Exactly.
sounds like Keystone is a nice environment where you feel comfortable, and
It is.
It's great, wonderful. So then, if somebody was thinking, okay, Keystone's for me, how would they find you and get started with
Right.
them?
So we have mechanisms. You can call I would direct you to KeystoneHealth.org. Depending on which type of practice site you're looking for, you'll see all of our services there. We have the ability to text. So if you want to text that phone number, for example, Keystone Internal Medicine, Keystone Family Medicine, and you want an appointment, we have the ability to do that. If you're busy during the day and you can't be on the phone, you can text us for appointments. You can call their phone numbers. We do have a patient access center that does scheduling for the majority of the primary care sites now. So it's one call to one location, and if they can't get you in at one site, they'll try and get you in at another site. So I would, just direct you to the website or call those practice sites directly.
Well, thanks for what you do and for sharing all that great information with us.
Thank you for having me and highlighting Keystone today.
Of
We
course.
appreciate it.
Yep. We'll be right back with Let's Talk Tri-State.
If you'd like to be featured on an upcoming episode of Let's Talk Tri-State, call 717-597-9200 or email letstalk@921thegoat.com.